Let's get going. Let's get going. Let's get going. Let's get going. Um, I'm considering doing something else today as I listen to this song, this controversial song here. As I listen to controversial song called um, there is let's see, how can I get this? Okay. Then we go. I have to give a link somewhere. I have to give a link somewhere. So no. Let's get the link so that I can make sure some people don't lose this topic. Then we go. I have to copy this, and then once you give a link somewhere. Today we are doing something else. Let's get the link so that I can make sure some people don't lose this topic. And we go. I have to copy this, and then if you are here, I know someone needs the link. I posted it somewhere. Let me post this link somewhere. Let me see live stream. Just to post it. Welcome everyone. Welcome everyone. Welcome to the channel. Welcome to the channel. Today we are continuing with the topic, but the topic will be slightly different. Slightly different from what we've discussed, because I've noticed some people are confused on whether to use hospital medicine or whether to use complementary medicine. So we should discuss this and let people know whether we can use hospital and the drugs that you understand. Something is popping up. Let me see. Yeah, that way. That way. That way. That way.
DJ Shinsky.
This is a controversial. Let me put it so like this, and then I drop it down here. Some songs, in fact, we put it like this so that you can. So I've noticed some people. Mercy, hi, welcome to the platform. And today we want to know when to use. I have to remove something here. When to use the the complementary medicine, the herbs. The drugs that we use in hospitals. They are called the drugs we use are called conventional medicine, but the ones that you use in the other way round, it is called conventional medicine. Conventional medicine. So today we want to know when to use complementary medicine and when to use hospital medicine. So let's see the let's see the something making a lot of noise here. Yes, that's stopped. Now, when you are considering complementary medicine, and you are in the hospital, and then you become confused, how can I use this drug? Today, that is what we will learn. We want to learn how you can use complementary medicine and use also what and use also conventional, the drugs that we use in the hospital. We want to get to know how to use these drugs, both of them. Now, when we say complementary medicine, is not only the medicines that we use, but even the practices. Hmm? Complementary medicine is the herbs plus the practices. So, you cannot replace medicine, conventional medicine, with complementary medicine, because right now the world has gone away higher. The world has gone away higher. We have advanced and we are moving with technology and advancement. So as we use the complementary medicine, we need to know how. The first thing we need to know when we are using the complementary medicine, when I'm talking of complementary medicine, you need to understand I'm talking about the herbs and practices of complementary medicine. The herbs and practices of complementary medicine. So we get to our topic here. Let me check. Yes, we get to our topic here. Let's get to our topic and we see how to use these drugs uh, bit by bit. So we will go on and say we'll go on and say when evidence exists, evidence-based complementary use, you just don't use any drug that you don't know if there is evidence. You see, complementary medicine, when our grandfathers were using them, they were not going to the laboratories and other technological areas to find out if they can be of use. You get it? So you need to go get the evidence. Has it been used for some time? Hmm? Who used it and it brought some complicated issue? And sometimes you should ask yourself, did this bring any, you should, as we talk right now, as we talk right now, you understand, sorry, still fixing some issues. As we talk right now, you understand that there are some issues that when you use and they don't have evidence, what happens? They become a problem, because when you go to the hospital, they start searching for some they start searching uh, for some research that they'll find some drug that or antidote to. You see, it becomes complicated. So when you are using complementary medicine as a drug at home, what should you do first? Because you cannot just start using complementary medicine. You cannot just start using complementary medicine and you have no evidence that this medicine has helped someone somewhere. You get it? It is, you will have problems. You will really have problems with the medicine that you are using. So we continue and say this. We continue and say this. One, it should have existing evidence. It should have existing evidence. Why should it have existing evidence? If I have a problem with my sound at times when it's raining, there is sound problem, please tell me. You tell me I have a problem with sound. Now it should have existing evidence. Like ginger, it has had evidence of controlling nausea for some time. Let me check for something. Check for something. Okay, let me check for something before we continue here. Let me check for something here. Mhm. Someone is asking if I'm online, so I want to. Let me just do that. Yes, yes, yes. Send you a link. Yes. Yes, we continue. We continue with the topic. We have said the first thing when using complementary medicine is what? it should have existing evidence. Like ginger and garlic, they have had existing evidence over years of treating nausea and vomiting. You see, the garlic and ginger, hyperlipidemia. Ginger, the one that you use at home, it has had evidence of treating high cholesterol levels. So the people who have high cholesterol levels, when you are using ginger, just know that you are treating high cholesterol levels. You get it? So it is very important when you are using, and it's evidence based that you are using it, because some people have used it. It has not been laboratory evidence proven, but currently it is proved and it has worked. So aloe vera in burns, it has been proved that it has been helping. So you use a product that evidently, when you talk to some people over time, it was used and it is still used to now. The neem plant, we have talked about it, about dental hygiene and skin infection. The neem has been of help. So the first thing you need to do is you find something that is evident based. Evident based, and evident based is called is by time, by the people that were using it. Don't just use something because you think it has helped someone and you don't, it has not been evidently based or used over time. You get it? Use herbs with documented benefit plus low toxicity. You should use herbs that have been documented benefits and has low toxicity. You see, that is very direct. Don't use herbs that have not been evidently, yes. Second thing you need to know, second thing you need to know is chronic non-life threatening conditions may, the medicine like the herbs, when I'm talking of complementary medicine, they may help when chronic pain, mild anxiety, insomnia. Insomnia is lack of sleep, functioning of gastrointestinal issues, disorders, and arthritis supported. You get it? And arthritis supported. And why? Long-term drug toxicity concerns. Long-term drug toxicity concerns. Long-term drug toxicity concerns. Hmm? Patients prefer natural options at times. You see, because people sometimes have phobia to go to the hospitals, and when they go to hospitals, they feel they are very sick. But when they are home being treated with this, they feel that they have low toxicity. They have low toxicity. Now, symptom relief, adjunct, it is called adjunct therapy. When you relieve pain, you feel you are a bit relieved. You get it? There are some symptoms when you relieve them, you feel that you are a bit relieved. You get? So that is called adjunct therapy. When you relieve pain, you feel at least better and you feel at least relieved. It's called adjunct therapy. Hmm? So appetite stimulation, when you are sick, sometimes appetite goes down and you feel appetite has come back. The immune, you see, we are at the third point, whereby the drug you are using as a herb is helping you to as an adjunct therapy by relieving a symptom. Maybe skin condition that you had has disappeared and you are relieving stress at times when you use that drug. You see, immune conditions, immune support, it boosts your immunity. It boosts your immunity and you feel at least really relieved. Now, but not this one. When I'm talking of adjunct therapy, I'm not talking about treatment. Adjunct therapy is symptom relieving thing. Adjunct therapy is symptom relieving thing. So you when you use that and you have evidence that it has given you appetite, immune support, your immunity is becoming stronger, or skin condition that you have is being cleared, but the main thing is not being treated. You see, it helps you become strong. And when you are relieved stress, when you are sick, how do you feel? You feel nice. You get it? You feel better. Now we continue here and say that there are some times when not to use complementary medicine, because it is not evidently laboratory proved, and research goes on for so long. You see, when it comes to research on something, it takes time for you get people, you start doing some statistics, and you're doing this statistic on human beings and some others, even in animals like rats. So it takes so long for you to concur that this drug can be used in human being, in a human being. So what do you do when you are not supposed to use complementary medicine? Life threatening diseases. Avoid herbs as a primary therapy. Avoid herbs as the main primary therapy when you have sepsis. First, sepsis means massive infection. Stroke, when you have stroke, this is when you need to go to the doctors. They do real research, they do their own tests, they do their own tests, and they find out what is really happening. You get it? What is really happening? So it is not of importance when you're having a problem. You 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 go to herbalist, and it's a problem that is intense. You get it? You go to a herbalist, and it is intense. This is a time where when you don't need to take these drugs, because it can be life threatening. When it needs a very important uh, diagnostic tools, like laboratory upgraded advanced tools like MRIs, and laboratory, like the machine that does full hemogram for a good diagnosis. This is where you don't use these drugs. You see, when you have stroke, these are conditions where you don't need to use them. When cancer is there, HIV, you understand, is still under investigation. TB, these are, I'm just singling out when not to use these drugs, because this is a life threatening condition. It's a life threatening condition, and it is, you are not supposed to gamble with life. So as a doc, when I'm talking about when not to use herbs, these are herbs. We have discussed herbs a lot, and this is now the topic that is very important: when to choose herbs and when not to choose herbs. You get it? Now, when to choose herbs, we have been given some. Let me go back and talk about this. This is when to use herbs. One, the first point we have said is when evidence exists, like when we have ginger, garlic, aloe vera, and the neem. When it treats the dental problems, you have evidence over time that this thing has been helping. You get it? That is the first point. The second point, when to use herbs: chronic or life threatening conditions. Hmm? Chronic and non life threatening conditions. There are some non-life threatening conditions that they are conditions that cannot kill you. You get it? This is where you can consider the herbs. This is where you can say, now let me use these herbs because they can help me. Which conditions are these? Like chronic pain, you are using the herbs and the pain is going down. We have talked about adjunct therapy. Mild anxiety, when you are anxious every time and you use a herb and you feel you are good, this is when you can use it. Insomnia, lack of sleep, and functional GI disorders in your stomach, when you have problems and you take a herb and it relieves, this is when you can use. This is a chronic thing and you can use it, but under care. You get it? Arthritis, support. Well, we have talked about arthritis, and arthritis we have said it is inflammation. So when you use it and you do not get arthritis, eh? And sometimes when symptoms, you are relieving the symptoms. When we're talking about adjunct therapy, when you are relieving the symptoms, this is where when you can use the herbs. You get it? So let's say that cultural acceptability is a very important thing, and this one is when you can use the herbs. Cultural acceptability, hmm? Very relevant, mostly when it comes to Africa. Patients strongly believe in herbs because it improves adherence and builds trust. And when you are mentally in association with, you have mentally associated with this, and everything is okay, you feel nice. You get it? You feel nice and everything becomes good. You get it? So let's continue and say herbs are good. Herbs are very good. But there are situations that I've come to this topic because people are confused why the doctor is talking about herbs, and he's a conventional doctor, a modern doctor. But now I'm giving the difference of herbs and when to use them and when not to use them. But remember, they should be evidence based. That is the 3 points that are very important when to consider. The 4 points that are very important when to consider herbs. But we have said there is a place whereby you don't need to consider herbs. When are do you know when are you not allowed to consider herbs? Let's say, when are you not to consider herbs? Because some herbs are life threatening, some herbs are life threatening. When are you not to consider herbs? When are you not to consider these herbs? Life threatening diseases, that is one, like septicemia, sepsis. When you have blood infection that is toxic, septicemia, my friend, don't consider herbs, go to hospital for due diligence diagnosis of technological, modern technological apparatus, so that we can treat you very fast, not to lose life. When you have stroke, don't think of when you have stroke, please don't think of herbs, because herbs are there to help us. We have talked about herbs for so long, but now we are talking here. We want to differentiate when you can consider herbs and when you cannot consider these herbs. You get it? Complementary medicine is important in life, but this is very serious, because when we talk about complementary medicine, people may think that the doctor said complementary medicine can cure. So let's use complementary medicine and not go to hospital. No. Situations like severe blood infection, which is called septicemia, a person has stroke, cancer for treatment, and you are you are saying that this will help me to treat this cancer. Be very careful, because whoa, that's where people go wrong. Yes, Mercy Grace. That is where people go wrong. People use this, over time, people have been using herbs, but because of deaths, we saw that these herbs cannot cure this, but they cannot do this. And remember, when we started talking about herbs and other things, what did we say about herbs? We said it should be evidence based over time. Two, it should make you feel good. And three, it should not have toxicity. So, over time, cancer is still under investigation and there is no cure. HIV is still under investigation. There is a disease like TB. TB has been treated with the TB therapy, isoniazid, pyrazinamide, Those are the drugs. And Ethambutol, yeah, you see, those are the drugs that treat TB. They are meant for TB. They are antibiotics for TB, and they have gone through more and more research, and they are the only ones that have come to show that they can treat TB. But over time, hi wise guy and chat, Betis world is here. Over time, we have seen that there is no other herb that can treat TB. And you see, TB can cause death. So don't juggle your life with herbs with TB. Severe malaria. Malaria is a parasite that goes inside your blood and destroys the red blood cells. So when you have severe malaria, don't juggle your life with malaria, because the parasite destroys your red blood cells and you really need aggressive treatment. So don't juggle with malaria, because delayed treatment kills you. And you know herbs, the herbs have no, there are no evidence. They have no evidence that they can treat. So we have talked on the benefit of the herbs, and now we are talking on when to use and when not to use. And when not to use, point 2 is narrow therapeutic index disease. Avoid herbs when patient is on narrow therapeutic index diseases. Therapeutic index means chances of a disease or a drug to kill you. So when I say therapeutic index of certain drug is 100%, I'm meaning the chances of that drug killing you is 0. So there are some drugs that they have so narrow therapeutic index like 5%. So when it is 5%, that drug has narrow therapeutic index and it may kill you. So when you are using narrow therapeutic index plus the herbs, and the herbs have toxicity, what does that mean? Those drugs can really kill you. They can really kill you. So drugs like warfarin, chemotherapy, antiarrhythmics of the heart, and anti-epileptic, they can kill you anytime, because they are strong drugs. Their therapeutic index is small. It is 5 to 10% or 15%. And that's why they are given only by specific doctors. Doctors that know what they are doing. So we don't gamble on with herbs. You get it? We don't gamble on with herbs. So I've said drugs that have narrow therapeutic index, and I've explained therapeutic index means chances of a drug killing you. So when I'm saying this drug has 100% therapeutic index, I'm meaning this drug cannot kill you. It has just side effects, but it cannot kill you. But when I'm saying this drug has a narrow therapeutic index, what I'm meaning is this drug, if it has 5% therapeutic index, it can easily kill you. You get it? Because of its toxicity. So you don't add a drug that is highly toxic and it is helping you, plus herbs that we don't know the kind of toxicity they have. You wait until your body is strong. After those drugs is done, you go to your herbs. You get it? This is a very important mercy grace. Reminds me of one lady stopped taking hypertension med with doctors. Guess what happened? I know what happened. This lady Mercy Grace, she might have got stroke or she might have died, which is so sad. So today I'm here to clear the air about herbs and medicine, and I've differentiated them. You see, it is very important. This lesson, please, when you need to share it, and share it widely, because as we talk of herbs and medicine and complementary medicine, the herbs plus conventional medicine, we need to differentiate and people to know when not to use the herbs and when to use the herbs, and that's what I'm doing today. Now we continue. You see, I've just explained clearly on when not to use these drugs and when not to use, when to use these drugs. And there is a very important point, and I'm still repeating it. There is a very important point called therapeutic index. Every drug you take in your body has toxic levels. So if level drug A is 15% and level drug B, very nice information, especially to our parents back at home. Yes, Ms. Grace, if your parents can read this, please forward them this video. Tell them to listen to it. If drug B has 98% in a therapeutic index, the one that has 15% can kill you easily, but the one that has 98% will slowly kill you or it will not. So you don't mix the drugs that we have in hospital and we know the therapeutic index, we have studied them over years, laboratory, technologically proven, with something that is not proven and is still under investigation, because we really didn't know the herbs therapeutic index and their ways of working. We know something called, in medicine there is something called pharmacodynamism and pharmacokinetism. This means dynamism on how the drug can work on your body, kinetism on how your body can wait a minute, on how the drug, your body can work. You get it? Hmm? A study of biochemicals. When we talk of conventional medicine, physiological and molecular effect of drugs on the body, dynamism, how that we don't know how herbs can work to your body, what the drug does to your body, pharmacodynamism, how the drug works to your body, we don't know. So when you hear about, when a doctor says that I don't know about the pharmacodynamism of the herbal drug, just know this doctor means he doesn't know how the herb can affect your body. And kinetism, how the body can react to your. So we have talked about the therapeutic index and I've really said you should be careful about it. Pregnancy is a very complicated thing. It is life, and you know you are growing a new life to this world. So it is important to check. It is important to check and see, am I pregnant? What can I use and what can I not use when I'm sick and I'm pregnant? You get it? Some drugs that are herbal, they are teratogenic. Teratogenic means they can destroy your fetus. They can destroy your fetus. And it is very important not to use these herbs because of pharmacodynamism, the word that I've explained, we don't know how it can affect your baby. And you know, there is something called embryology when a woman is pregnant, how the baby forms and how the baby grows up. It can be affecting. You see, when the bomb of Hiroshima and Nagasaki came out, so many children were affected. So many children were born with defects because it affected the embryo's development, mutations. You get it? So you don't take herbal drugs that we don't know the pharmacodynamism, how it can affect your body and the child's, because it may bring some mutation. You have seen children that are born with cleft lip palate, the palate that is, you see, greetings to you, Dr. Ben. I just see your message. Thanks a lot, Uncle. Uncle, today we are talking about the specific thing, when not to use herbs, when to use it, because it has been a confusion for some people. And we should share this message widely, when to not to use. So we are talking about mutation. You can take a herbal medicine when you are pregnant women, and what will happen? Maybe it will form a mutation. Your baby may be born with a defect. You get it? When someone has a problem and is sick, and a person is feeling not okay as a pregnant woman, go to hospital to identify the problem. I've just given an example of a bomb that happened some years ago in Nagasaki and Hiroshima. You remember women were giving up children that are having mutations and defects, because when the bomb went out, it was so bad, and they inhaled the particles, and when they inhaled, the pregnant women, it became, when embryology, when the fetus is being formed, it didn't form well. So what happens? It started having some problems. These problems are called mutations, and herbal medicines that are not proven can bring these mutations. Herbal medicine that are not proven can bring this mutation. You get it? So when a person is pregnant, it can be, and even you can get an abortion. You never know, because you don't know. There are some drugs, when you take them, they induce contractions. Herbal medicine, and in hospital we know which drugs, but with herbs we don't know which drugs can bring mutations. You know, when you are pregnant, you are not, when you are early, the first semester in pregnancy, there are some drugs that you are not supposed to do, because we know what they can do. But when you are taking this other medicine, you can never know which drug you can not take. You get it? Like the neem plant, aloe vera, and artemisia high doses, and those are the neem is very bitter, and you saw how we talked about it and what it can do. So when you are pregnant, please don't take these drugs. Mercy Grace advise women at home, be the messiah of good health. Tell women, some women really like taking herbal medicine. Some women really like taking up even when they are pregnant. Please advise these women when it comes to this problem. You get it? Yes. Let's continue. We have said pregnancy. Now we go to liver or kidney diseases. The liver or kidney diseases. When it comes to liver and kidney diseases, when we feel someone has a problem with the kidney, we give, in the hospital now, we usually give drugs that are metabolized not in the kidney. We give drugs that are metabolized not in the liver, but in blood plasma. When they are metabolized, metabolism means breaking down that compound and turning it to water soluble from fat soluble, so that it can be eliminated from the body. And that process is energy consuming. So imagine a person who has a liver disease, and then we are giving a drug that is metabolized in the liver itself. The liver itself will be strained, and it can die off. So when it comes to herbal diseases, you never know this herb that I'm using. Is it metabolized in blood plasma, liver, or the kidney? So if you give a person who has liver issues and the metabolism is in the liver, what will happen? The liver will shut off, because first the liver is sick, and then you are giving another herb that you don't know where it is metabolized, and it is highly metabolized in the liver itself. This person will shut off because of toxicity. So when you are having problems with the liver, please, this is not the time of giving this herbal medicine. Go to hospital. When you see someone having yellow eyes, when this person is sick, just know there is a problem with the liver. There is a problem with the liver because of hepatocytes. Liver cells are dying and producing jaundice. So this is the time when you really go to hospital to find how out conventional medicine. Please, if you are joining me and you don't understand and you have a question, this is a very informative session and it is very crucial when it comes to herbal medicine. Please ask a question, even if you feel it is a very stupid question, ask it. I want people to understand this. It is very important. And this is where people go wrong. People use herbal medicine until they are so bad, and then they come at the hospital when at they are brink of going. So we do very little before this person leaves us. It is very important you listen to this and share to the old generation of that person that you know loves herbal medicine. You get it? I have said one thing called metabolism. Metabolism is this process. The liver turns something can dissolve in protein to something that can dissolve in water. Why? Because if it is not turned to something can dissolve in water, it cannot be removed from your body through urine or feces. If it is only protein soluble or fat soluble, it will remain in your body and it will be toxic because your body is full of proteins and cholesterol. So that is metabolism. Removing toxicity and changing something to water soluble so that you can urinate. Hmm? Yes, Paul, Beatrice. Yes, you can urinate, or what can you do? You can go to the loo. That is very important. So we say this and we say this again. Some herbal medicine, you never know where they're being metabolized because I've repeated, a person who is sick in the liver comes to hospital. We find out this person has liver cirrhosis. We will find a drug that is not metabolized in the liver but somewhere else like the kidney or the blood plasma, but does the same purpose if it is an antibiotic to reduce the weight of the liver to let it heal slowly by slowly. That is the reason why I'm saying when you have liver or kidney disease, don't use herbs because we don't know where it is being metabolized. Don't use herbs because we don't know where it is being metabolized. It is avoid in liver cirrhosis or chronic kidney diseases because whatever that for talking this today. Yes, very much. Thanks very much, Mercy. You get it? So we continue and say how to select complementary medicine safely. How can you select complementary medicine safely? One, step one, is there any research in this herb that I'm using? Is there any research in this herb that I'm using? Is it traditional myth? There are some evidence traditionally, but there are some herbs that are myths. Myths. They don't have any evidence, but it's just a myth. Be careful with that. You get it? Use hierarchy. Hierarchy of what? Strong. Is there any medical or clinical trial ongoing on this drug conventionally in the hospitals, in the laboratory research? Is there any evidence? Are there any moderate research, small studies, or weak? Weak, we mean it is only used traditionally. There is no research, there is no small studies. Find out if it is in any of those. So when it is weak, just know there is a pro because it was used traditionally, but there is no anything that is proving that you can use this on research or a body of a human being. I'm helping people to know how to use these drugs when it comes to assess toxicity profile. this drug that you are taking, this drug that you are taking, is it toxic? When you take it, do you see yellowness of your eyes and palms? Because when you take a herb or a drug and then you see yellowness of your eyes and palms, what do you know? You find out that it is killing the liver cells. That's why it is producing the yellowness. The yellowness is called jaundice. You get it? Is it neurotoxic? When you take it, are you confused or do you lack energy to walk or to walk? You get it? Find out. High risk herbs are there. They are there and we use them and people use them. And when these people use them, the high risk drugs, what happens? They find problems. There are high risk drugs like neem oil, comfrey, kava, and acotine. Kava is highly toxic to the liver. Neem is highly toxic to the liver too. When you use, and even the stomach, it can produce bad effects to your stomach when used in a bad way. You get it? When used in a bad way. Avoid internal use. Mostly use herbs when it is atopic. Atopic means when it is in the skin or inhalation, it will have low toxic measures. We go to step 3. I'm going very slowly so that people can understand this so well. When to use herbal drugs and when not to use herbal drugs. You get it? Now, we are going to step 3. Dosage. I remember someone mentioned and asked me, how can I know the dosage? Now, that person listen so well. Listen to this so well. The dosage. Toxicity is equal to dose minus dependence. Like example, garlic is safe in food, but it is very toxic in extract. Use food levels dosage when possible. Don't extract its components to use. You will get toxicity, but when you are taking in food, it is okay. The garlic that we only use at home, you see, it is very important to listen to that. I have 10 minutes, I have to hurry up before I finish. Now, we have something called step 4, check patient's fact. Age is important. Herbs are toxic to children and risky to children. Their immunity is still struggling to come up. The liver is still tender and still knowing how to handle some things. So you don't just give your children herbs and say they are good. You see, very important. Children don't, unless there is a strong evidence of that herb. Don't give children herbs in high quantities. You've seen children, comorbidities, people that have low immunocompromised people, diabetes when it comes to low hypoglycemia and hyperglycemia. Avoid herbs, please, because these are proved with technology. These are proved in the laboratory, and when you gamble with it, your life can go. Hypertension, high blood pressure, liver diseases. I've just talked about what toxicity in metabolism means. Step 5, check drug herb interaction. You are on diabetic drugs or antihypertensive drugs. You are taking ARVs. Does that herb that you are taking interact with the drugs you are taking? For people who are taking chronic drugs, chronic problem drugs, the ones that I've just mentioned, because you may take a drug and it interacts and it becomes a very big problem. You see that? So, some major interaction, there is an enzyme called CYP for 50, when it comes to interactions, it really brings bad outcomes. And you see the St. John's wort, St. John's wort. Please, this is an advice. If you are on antiretrovirals, if you are on antiretrovirals, what do you do? Avoid St. John's wort. It reduces help, how it can help you. Additive toxicity to the liver, like TB drugs. They are highly toxic to the liver and you are using herbs. Additive pharmacological effects, like garlic plus aspirin. When you are using garlic, it thins the blood. And then you are using again aspirin. What does it do? You bleed. Even when you brush your teeth, you start bleeding. You get it? So there are some things you should check if you are on continuous aspirin use. Check about those herbs that interact with aspirin. Don't use them. The neem plant, the one we called the Mwarubaini, Azathirica indica, that one. It reduces your blood glucose. It reduces your blood glucose. And you are on insulin. Your sugars will go low. You'll get hypoglycemia, and then you can find you unconscious. And you know, when you go unconscious for so long, what happens? When you go unconscious for so long, we may lose you. We may lose you. It is important to check on these herbs, and I'm giving examples. And this is where I'm talking where not to rely on herbs and when not to use herbs. Now, there are red flags for herbal toxicity. Unexplained hepatitis. You are weak. You have just used a herbal drug, and then you become so weak, and yellowness of the eyes and everywhere and the palms, like a person who has malaria. Please rush to hospital. You use some herbs, and then you have kidney injury. Your pressure goes high. You stop urinating, or sometimes you have seizures, or when you measure your blood glucose, if you have been using insulin or metformin and those drugs of diabetes, you find your sugars are 1. Rush to hospital, because you don't know if the herb that you have taken, for what time it will be cleared to your body. Go to hospital. And there are some herbs that can induce coagulopathy, clotting in your body. You start feeling numb in your legs and extremities, like you don't feel some parts of your body. Rush to hospital. I've said unexplained hepatitis, acute kidney injury, seizures, hypoglycemia, coagulopathy. When you use herbs and you feel this, please rush to hospital. It is very important you rush to hospital so that you cannot get toxicity. Now, there are some things when you go to hospital you may be asked, like, are you using any herb? Please say the truth. Say the truth so that the doctor can know what next step to do. And it will save you some money, because if you say yes and you know the herb that you are using, we will definitely know this herb can cause this. So this doctor will not take your blood to go to the laboratory to do some studies so that he can know to help you. It will be saving you some money. Identify the herb. Tell the doctor. You get it? This will reduce time to save your life. Risk stratify. Topical use, food use, or short duration. How long? Tell the doctor for how long you've been using this drug. Because drugs have said they are toxic, And when drugs are toxic, you know what they can do. Hmm? So this is a topic that is very important, and I'll be, as we continue finishing these topics on herb, I'll be reminding everyone on what to do. Is the herb that you are using oil ingested, concentrated extract, or mixed herbal cocktail? Tell the doctor that I've been using. And sometimes, how can you avoid toxicity when you are using herbs? Use complementary, not alternative medicine. There is a difference between complementary and alternative medicine, and I talked about it. Complementary medicine is herbal drugs that have been proved over time and have been attested over time. Conventional medicine are drugs that, as doctors, we do what we use in hospital. So what is the difference between complementary medicine and alternative medicine? You see, there is complementary herbs and alternative medicine. Let's see the difference, because not all herbs are complementary medicine. Not all herbs are complementary medicine. Complementary medicine are used together with conventional medicine, the drugs that we use in hospital. You get it? But alternative medicine means instead of conventional medicine, you are using only that. Hmm? So, complementary medicine with modern medicine, that is complementary. You can use complementary or modern medicine. The other one, complementary medicine, supports recovery. You get it? Supports recovery. Complementary medicine, safe when supervised. It is safe when supervised. You get it? But there is evidence plus tradition combined. There is evidence plus tradition combined. You get it? And then we have something called alternative, the one now I'm talking about. Used instead of modern medicine. You're just using herbs and not any modern medicine. Replace hospital treatment completely. Risk of worsening diseases, often lack strong scientific evidence. That is what we call alternative medicine. So when you want to avoid toxicity, of complementary medicine, you use complementary and not alternative. Continue on the treatment that you are given in hospital. You get it? Avoid polyherb mixing. Don't have mix more than 5 herbs because you think you will heal faster. The I've talked about toxicity in the liver and therapeutic index. You get it? Avoid concentrated extracts like teas and food. No, don't. Limit duration. Don't use them for so long and you are in hospital medicine. You will get liver injury. I've talked about that. Avoid unknown sources. Get a drug that you know where the source is. You may be taking an herbal medicine that is, you may be taking a herbal medicine that is a pesticide. And I've said there are some risky groups that you should always avoid herbs. Risk groups. What are these risky groups that should avoid these drugs completely? Pregnant women, elderly women, infant, liver disease, infants and small children just born, liver disease patient with kidney injuries, please avoid them. HIV patients on ARVs and TB patients that are on treatment. So there are sometimes you may want to know the simple rule of avoiding and be safe. You just say safe. And then S means scientific evidence. Is there real data? A. A means adverse effects known. Are adverse effects known? Is there any toxicity of this drug? And there is F. Is it fit with patient's condition? Is it fit with patient's condition? E. Exposure. Is it food level or extract? Am I using in food or extracts from that? You get it? Very important. So we have talked of very many things like hypoglycemia, TB patients. Hypoglycemia means low blood sugars. And it is clear now, I've said it is clear now on when to avoid this drug or when you can use these drugs. If I have 5 minutes. I don't know if there is anyone who has a question today. Anyone who has a question? If you have a question today, please tell me, bring it down before I close so that we can know how we can help each other. It is very important to be asking questions because a question can save someone. A question can save someone, can save someone's life. You get it? If you have a question, please put it. I'm waiting. I still have like 5 minutes. I had to come out to this topic because you've seen very many people have been asking me for dosages. You've seen many people have been asking me, can I use it on arthritis? You've seen many people have been asking me, can I use it on this? So this topic is very important. Share it to a person who is using herbal medicine. And so I'm seeing today people are so calm and there is no question. If there is no question, please have a lovely day, a lovely night wherever you are, and be blessed. Any question? Let me give some 5 minutes. Maybe someone is typing and I'm rushing to go. Any question between anyone who is in the chat? Any question? Any question? Yes, there is no question. So let's meet tomorrow for question and answer. Let's meet for question and answer because it's a weekend. You know, weekend we don't have topics, but we can meet and discuss some question and answers that we have been through the week. Let's meet tomorrow. You prepare your questions tomorrow. You can bring them openly, but I'll have some random topics. I'll have some random topics tomorrow that we'll be talking about and going through. But today you have known when to use herbal medicine and when not to use herbal medicine. So let's meet tomorrow. Sleep tight for those who are in Africa. For those who are in the US and UK, have a lovely day. I might come at 4:30. If I will not be there at 4:30, I'll come here at the same time that I'm here today. Most of the time when I'm busy at 4:30, I postpone to this time because you may say you are coming at 4:30 and you are so busy up and down with patients or in the hospital. So you just have to find some time to come when you have some time. Good night. Let's meet tomorrow.